Hi, I'm Pam Mosdale. I'm QI Clinical Lead at RCVS Knowledge. Well, I think as vets and nurses, we all know that clinical governance must be part of our activities. And clinical governance is about a framework of improving care and looking at what we do. And quality improvement is about how we actually do that. It gives us the tools to do it. And the definition I like is that quality improvement is a process that helps with improving outcomes, improving care for our patients, and improving learning for the whole practice team. And of course, the other thing people ask me is what's quality in veterinary care? And quality, I think, can be defined as providing care that's safe, that's timely, that's effective, very importantly, that's focuses on the patients, focuses on the veterinary team, on the clients, and on animal welfare. So those are the important things. Well, it's all about improving care and outcomes. And I think everyone who works in veterinary practices, in whatever role they're in, goes to work to give the best possible care to their patients and to have the best possible outcomes. It's also about the team learning together. And therefore, learning together about when things happen can lead to better communication and better morale for the team. I think the best approach is to start by asking the team what they think might improve in the practice. What are the things on a day-to-day basis that are the irritations, the stones in their shoes, the things that if they were improved would make life so much better and easier? And I think that's especially relevant at the moment. So I think asking the team those things is a great way to start. And then it's measuring to see if there is actually an issue. You might think you've got an issue with a certain process that's going on in the practice, but unless you measure it, you don't know if there is an issue or not, and you don't know the extent of the issue. So using clinical audit to measure is really important. And then making small changes, very small changes, little bit at a time, gradually improving things. It's about a slow evolution rather than a massive revolution. And emphasize as well, it's all about systems, and it's not about blaming, it's about improving systems. It's not about blaming individuals. It's about improving systems, and that way people know what's going on. And I think that's also important, to be really transparent to make sure your team knows what's happening. The whole team, everyone. I really think it doesn't work unless it is holistic, unless everyone in the team. It's not just the vets, it's not just the vets and veterinary nurses, it's everyone. It's the reception, front of house staff, it's the practice managers, it's any kennel assistants or anybody, because you all work together as a team, and sometimes things that happen in one area can impact things that happen in another area. So as long as, if they're not discussed by the whole team, you don't get the whole picture. Clinical audit is all about measuring. It's about measuring what you do and then talking to your team, and then making some changes, measuring again, and then either adopting those changes if they've had the desired effect, or adapting them if they've made a bit of an improvement, but not as much as you expect them to, or abandoning them. So by clinical audit, but also I think it's really good to have visuals that your team can see. So you can use run charts where you show the improvement in a continuous manner. You can have notice boards which show the results, graphs and graphics. They're all good, a way to get the team engaged and to actually measure. And of course, ultimately, how you measure it is that you can have better outcomes, better care, and a happier team. I think the most important leadership skill of anybody wanting to implement quality improvement is listening. I think listening to your team is by far the most important thing. And then taking it very slowly, bringing your team along with you. So as I said before, asking them what things they think should need to improve, forming a plan, making sure they're informed all the way through and that people don't think something's happening behind their back. And then supporting the team, empowering team members who want to run audits or quality improvement sessions or use checklists or have significant event meetings, empowering them and helping them and asking them what they need. Again, making sure that people know it's about improving systems, not judging individuals. and looking at your systems, and of course managing change, because it will result in change. It's bound to result in change, and change is always a little bit worrying for people, I think. So being very careful. I think if we go slowly and explain how the changes are going to have you hope a positive effect, but you're going to test them out, and if they don't have a positive effect, you're not going to implement them. I think those are important. Managing change, empowering your team, being careful to avoid hierarchies as much as possible, so everybody can input, the whole team, and have a sort of mindset change, really, from a firefighting aspect where you're always looking at problems to one where you're looking in advance what might improve. I always think of it a little bit like preventative medicine. You know, in the veterinary profession, we're very keen on preventative medicine before the issues happen, and I think quality improvement is very like that. And also raising awareness and making sure that your team have the educational things that they need. And at RCVS Knowledge, we've got some great resources. Get them to have a look at our website. We've got some great free resources on all aspects of quality improvement. So making sure they've got the knowledge as well. Well, teams might be a little bit uncomfortable thinking about things they don't think they do very well, and might not want to start discussing those. And they also might be uncomfortable thinking about their own performance and whether that being measured might be challenging. So again, they need to be reassured that this is about improving systems. It's not looking at individuals' performance, it's about improving systems for the whole practice. There will be, as I said before, resistance to change, and I think so taking it slowly and trying to bring the whole team along with you is really important. I think once the teams see results, so I think it's great to start off with bite-sized projects, because if the team can see results that we did that, we changed that, this is the difference it's made, then they're going to be more motivated to start looking at other changes they might make. I think time is the biggest challenge of all, making time. Veterinary practices are so busy, particularly busy at the moment. Making time is really difficult. You have to think about how you can slot this into the day. What is there something that you're doing that you don't really need to be doing that you could do this instead of? And again, making it bite-sized and incorporating it so it becomes part of a normal day, not something special or extra that people are having to do extra on top of what they do, but part of a normal day. So just, you know, make some little changes first, little steps, and eventually you'll start taking bigger steps and running. It's really important, and if you've done QI projects, to actually share them, because other teams will be looking at, as you are, to see what they can possibly do. So sharing those results is great within your practice group, within your own practice, within your practice group, but also sharing them more widely with the whole profession. And at Knowledge, we have Knowledge Awards, which people can enter for, and we have loads of case examples which have come from those. So we'll share anyone's case examples if they want to share them, because I think it's really great to see what other people have done and really motivating. There's also whole profession benchmarking exercises, some of which we're involved in at Knowledge. So things like the National Audit of Small Animal Neutering, where you can compare your results to all the practices that have submitted, Canine Cruciate Registry, Farm Vet Champions about antimicrobial resistance. And there's lots of there's a colleague audit at Liverpool University. So getting involved in profession-wide activities is also good. Yeah, so I think, yeah, just share would be my view on that.